Welcome to your program of choice, Health Affair on AIT, a platform where we focus on public health challenges, issues about women and children, with a view to providing lasting solutions. I am your regular anchor, Oshuomowa Daniels. Our focus today is on uterine fibroid. We'll be right back after the news segment. Please don't go away.
Customer, here are the tomatoes. What else shall I give you?
Add pepper and... Auntie, this your cough is getting out of hand now.
Take it easy with her now. But customer, this your cough. You should go to the hospital.
You know I can't go there with this cough at this time. They'll just say I have COVID-19.
Customer, every cough is different. It could be tuberculosis.
It's true, Auntie. Check am make you dey sure.
Because who no go?
No go, no!
Check that cough for tuberculosis.
Check am make you dey sure.
If your cough is more than 2 weeks, it could be tuberculosis. TB tests and TB treatment are free. Just call the National TB Hotline on 3340 for information on where to get the test. This message is brought to you by the Federal Ministry of Health with support from the American people.
Tuberculosis is a potentially serious infectious bacterial disease that mainly affects the lungs. The bacteria that causes tuberculosis is spread through air droplets. The many myths and misconceptions surrounding the disease has hampered efforts by relevant authorities to identify many missing cases, especially children, to access treatment.
Nigeria is number one in terms of the burden of tuberculosis in Africa and 60 globally. An unintervened case, one case of tuberculosis has the capacity to infect not less than 15 people in a year. And so if in a country that we have an average of 550,000 people in a year to get infected with tuberculosis, if you times that by 15, you see that Nigeria is actually sitting on a keg of gunpowder that can explode anytime. It will be forgiven if we, do not scale up on our strategies towards, improving on case detection and placing the children on care for absolute cure. And by the way, how do children get it? The children get it from the adults. So why should we, be doing very well in terms of detecting tuberculosis and preventing further spread in adults and then leaving the children behind. So that's why we call for these stakeholders to brainstorm, to fine-tune our strategy towards improving our case detection amongst the children and also placing them appropriate treatment for absolute cure.
About 67 to 70,000 are the cases that occur in children. That is the new cases that occur in children annually. We are only able to recognize about 13,000 children out of close to 70,000 children, which is quite abysmal. In the case of children, the type of TB disease they have is not the one that is easily transmissible. It is adults around children that usually transfer or transmit TB to children around. Most important intervention is identifying the cases, because it's only when you identify the cases that you are able to place them on treatment.
The experts also expressed concerns about the predisposing factors to tuberculosis, such as HIV and malnutrition.
A child wakes up and starts crying and refuses food to hear about. That means something is wrong. You must not wait until that baby gets to the growth monitoring clinic, because the baby may not be gaining weight. So we want us to look around. What can we do? How can we make sure that we work together to make sure we protect those children? Now, if we believe that it's even documented that HIV is one of the drivers of tuberculosis, to what extent are we discussing with our colleagues that are intervening on HIV, especially for the children? Because from the program that prevents from infection of HIV from mother to child, how do we interact with all those our colleagues in that space, so that we'll be able to protect the child? For the nutrition aspect of it, to what extent are we talking with the various programs that are in charge of nutrition amongst the children, so that we'll be able to come down together and be able to rescue the child. So that's majorly what we want to achieve at the end. And then we'll be able to come up, with confirm our what works and what will not work, and come up with that roadmap. In fact, what we are planning is to have our roadmap on what we can do, so that at the end we'll be able to access to see what we are doing. And we expect that we'll be able, because I have, very good important stakeholders. We have the academicians, we have the WHO, from the American government, USAID, you have people from CDC, people from civil society, and people that have, been affected by tuberculosis. We also have the program manager, the state TB, leprosy, and brucellosis control programs, and every person, the gentlemen of the media also present to make sure that we're able to get everything sorted out.
While most people with the disease are mostly asymptomatic, some present with cough, weight loss, night sweats, and fever.
Tuberculosis is preventable, tuberculosis is treatable, tuberculosis is curable, and the services for tuberculosis is free. So if you notice any person that has coughed for more than 2 weeks, please, the person should go to the hospital. Or if you think you are coughing, you do not know where to go, call the national toll line 3340. You'll be directed accordingly.
Another issue that must be addressed, according to the expert, is stigmatization that prevents many people from speaking up.
The project, known locally as Project for Girls and Women by Girls and Women, strengthens what the Institute has been doing with cervical cancer and control over the years. The Institute, in addition to its work on cervical cancer prevention and advocacy, is a leading center for making cervical cancer screening accessible to the public through community-based screening via visual inspection and HPV testing. Cancer of the uterine cervix, commonly known as cervical cancer, is the fourth most common cancer among women globally, and currently, one life is lost every 2 minutes to this disease. In 2020 alone, an estimated over 600,000 new cases and over 300,000 deaths occurred, with more than 90% in low and middle income countries. Over 36 million women over age of 15 years in Nigeria are at the risk of developing cervical cancer. Cervical cancer is caused by human papilloma virus. It's a virus that is extremely common worldwide and is acquired sexually, and it often impacts young adults who become sexually active early in their lives. Although cervical cancer guidelines and strategies have been developed in Nigeria, coverage across the country is low. To reach the elimination targets, organized national program for HPV vaccination and cervical cancer screening and treatment must be implemented across the whole country, and competence of healthcare will need to be strengthened across all three pillars: HPV vaccinations, cervical cancer screening, and treatment. It is against bad disrupt that this project, Action for Collaborative Community Engaged Strategy for HPV, Access to HPV, was conceived to support the Nigerian National Cancer Prevention and Control Program in its drive to join other nations of the world to eliminate cervical cancer by 2030. In this project, our team will utilize the special bond between mothers and other female caregivers and their daughters to improve HPV vaccination of young girls and HPV screening of mothers and caregivers. Hence, our local name for the project, For Girls and Women, for Girls and Women.
My name is Uchama Wozur, and I'm an assistant professor at Wake Forest School of Medicine and a co-investigator on the project. So given the growing burden of cervical cancer in Nigeria and some of the management approaches that may not have particularly worked because the voices of these females, mothers and daughters, are not being accounted for, the hope is that this project is driven by mothers and their daughters.
So my name is Chisomo Biezume. We want to increase vaccination. We want to increase screening. So hence, our project is really asking young women young girls and women to tell us their ideas, to bring their ideas to the table.
In partnership with Aishat Yusuf Aromire Foundation, which empowers women's football players, we are working towards ending sexual and gender-based violence in Nigeria. There are alarming reports across the world which reveals that sexual harassment and emotional and verbal abuse that women go through are numerous. There are several benefits of sports, and one of the things that we intend to do with this press conference is to strengthen that relationship, that will further that unity that sports normally bring, to us as a country. In sports, there's no ethnicity. In sports, there's no religion. Oftentimes, Nigerians work hand in hand to ensure that we have success, anytime that we have to go for the sporting game. The same type of assumptions that we have around sports also gives us the impression that sport has no gender. So in that regard, it can help in addressing the issue of gender inequality. We are working in about 123 communities across Nigeria. So what we plan to do with this partnership is to ensure that we use the word of sports to build unity amongst men and women so that we can end sexual and gender-based violence in those places.
I lost my dad when I was 9, and at some point I was taken away from my mom for like 7 good years. I don't even know who my mother was, just because they don't want me to play football. And there's not any other reason. The only reason is because I'm a girl child. So for football, you as a girl, you're not allowed. So it got to some point whereby I have to take the bull by the horns and I have to decide myself that at some point I have to run away from home just for me to play football. So but when I made it to the limelight, then the story changed from grass to grace, and of which I wouldn't want any other girl child out there to go through the same thing. And this is the reason why, and the reflection of my life, to have my foundation in Nigeria. I based abroad. I live in Finland, to be precise. I've been there for 18 years, and I have my children over there. So I have seen it all when it comes to sports, in girls' aspects, combining Africa and Europeans. And this is the reason why I deem it fit to have a foundation in Nigeria, and my own little way of giving back to my society, remembering my roots, and most importantly, to empower young girls, to motivate them, at the same time to empower women in sport. And for me, I think this partnership is very critical. It's most important for me. And I want to sincerely thank you very much, Ma, for coming on board, because I think at this point, we need to use sport to unite people. Obviously, when the game is going on in the world, there's more love. And like she rightly said, football itself has no gender. You cannot define if it's a boy or a girl. So basically, everyone should have the right to do sport.
Welcome back. Uterine fibroids are non-cancerous growths that develop around the uterus. They often appear during childbearing age and common among Black women of African descent. We have with us on the program today some experts to tell us more about the disease.
Fibroid is a disease, but it's not as people are thinking, because some people think that fibroid is cancer, is not cancerous. Fibroid is a growth, just like any other growth, and non-cancerous. Fibroid grows in the womb and no other place. So when it grows, it can become very oppressive and disfigure people. So when you look at a woman, she's been carrying it for almost like about 11 years. And ignorance makes some of us say, oh, she's been pregnant for 11 years. She has not been. Fibroid is oppressive on that woman because it makes her cachectic. And for some of them, it's bleeding, all that. So she doesn't have enough blood. And once you deal with fibroid, it stops. So fibroid is not inherited. So that tells you you could take that fibroid out. And people believe so many things, that once there is fibroid, it's death. No, it's not true. You hear some people, oh, they went to, what's the name, the jaw women. They will use their half knowledge or no knowledge and say they want to deal with the fibroid. There are some women who they destroy their reproductive system. There are occasions where they tell you they will have to use pots on your stomach, and that would help. There are occasions where they will even give you what you don't have. It's basically for the black woman. There was a day we were theorizing, maybe, but I think fibroid is basically hormonal and doesn't grow any other place, because, like, if fibroid is something that can grow in a man, you can say it's maybe genetic or something like that. No, it's not. Because when you remove a womb, right, from a woman, we don't have fibroid again. But, again, our culture, our belief is that every woman should have womb. Even when there is fibroid and you are telling them that you want to remove that fibroid and remove the womb, they will say no. Leave the womb. Remove the fibroid. And you can remove the fibroid. And like you go to farm, the thing grows back. The weed grows back in the farm once you finish within the farm. So you have it in the same womb that you left. So some people go through it 1, 2, 3. And as they keep on doing surgeries, they keep on exposing themselves to complications from surgery. But if it's like what you see outside, people say, okay, what's the essence? Must I have child and die? Right? Let me take care of my health. I'm the most important person here. So whatever you are doing, you must know what you do to get the best out for that person. If you are talking about people who die from fibroid, in the present day knowledge that we have about fibroid, it's basically limited. It's like, where do you expose yourself to? And who is doing what? If somebody does not know what to do, they will do what they don't know. And that can be an issue for that person. The surgery, the effects, the post-op recoveries are all under control if it's done by somebody who knows what. If there is fibroid, right? And you know when that fibroid occurs, and you don't allow that fibroid to take over everything, you can easily remove.
After I've gotten to like 50 years, by then I expected I would have stopped menstruating. But lo and behold, every month I was still bleeding for like 2 weeks. Then I had to go and see the doctor, who sent me for a scan. When I had the scan, I was told I had fibroid. Even though the fibroids were very small, but I was able to understand that that could be the cause of my monthly bleeding as at while I was already 15 years. So I was advised to go and take off the fibroid. Since I was done with having my children, I decided it was best for me to take off the womb, because when there is no womb, there won't be a place for the fibroid to grow. But I want to say that fibroid is not a killer disease. I've heard some people say that they lost one friend, one relative because of fibroid. It's not the fibroid itself that kills. I advise that if you are told that you have fibroid, the best thing is for you to go and take it off. Take it off in the right place by the right people, not by going to all these babalawos, Ijo women that could destroy your womb, traditional healers that could actually destroy your womb rather than treating you or taking off the fibroid. No. So I don't believe that.
Operating on things that are very expensive. What do you think government can do to help in this direction?
Government can actually fund some surgeries. We have foundations that can actually bear the burden of the cost of surgeries. People like Rotary clubs have funded some fibroid surgeries. So you go to where these people are. Most times we tend to understand that some of the people that have fibroid find it difficult to meet up with the cost. So government could actually find out people that have this fibroid, and it's usually women. And thank God that the World Health Organization is interested in women. They could actually help to make things easy for women.
Coming to the hospital, first of all, there's something called history taking. That's the first point of seeing the patient. So you get all the history from the patient, and then when you have an open ground to speak to your doctor, ask lots of questions. What's the success rate? Or what is it like? You voice your fears, your concerns, and then you get replies, and then it's much more easier for you to work with the doctor one-on-one.
If you're just joining us, it's Health Affair on AIT. Next on the program is our nutrition segment.
Beetroot is one of the healthiest vegetables. It is the taproot portion of the beet plant, mostly grown for its edible taproots and leaves. Beetroot, also known as blood turnips, apart from being used as food, is a medicinal plant that has been used for ages in the treatment of numerous conditions. Though beetroot comes in different colors, red is more common. They can be eaten raw, as juice, or eaten as salads. The health benefits of this wonderful plant has been widely researched. Beetroot, due to its low sodium, fat, and high folate content, supports mental and emotional well-being. Beetroot, according to experts, may delay signs of premature aging. It can promote skin, liver, and brain health. It is beneficial during pregnancy. It lowers blood pressure, reduces the risk of heart diseases, aids in cancer prevention, helps fight inflammation.
This is how we wrap it up today. Please join us same time next week for another interesting edition of the program. Please don't forget to advertise your health product and services on the platform. We'll do it for you at a subsidized rate. I remain yours truly, Oshuomowa Daniels. Please keep staying safe.